So they come in for pain treatment or substance abuse or PTSD treatment, and we administer ketamine.
Okay.
To them.
Oh wow.
And
okay.
We kind of oversee that psychedelic experience that people are having that helps them get better.
Interesting. Okay. So now I'm new to all of that. I don't know much of that. As far as ketamine goes, is that something like, how does that work? Ketamine
was made in a lab. They initially used it as an anesthetic for people going into surgery.
Okay.
And then over the years, I would say like in the 60s, the 70s, the doctors administering the medication started noticing that it would help with pain. The patients were coming out of anesthesia talking about these experiences that they couldn't explain, kind of like a NDE kind of experience.
Really?
So people started, people would research it. Clinicians would research it. They found that it does wonders for chronic pain. It would help people with PTSD, any kind of trauma, sexual abuse, physical abuse. So it's one of the only medications right now that's a psychedelic that's really being used for different kind of things right now.
That's really interesting.
Eating disorders, trauma.
Yeah, that's really interesting. So it could be used for anything.
Yes, it can. It has a bad stigma that comes with it because it was initially given to horses, so veterinarians used it. People got a hold of it. They used it at parties or clubs and stuff before. So when I have a majority of my patients that come in, that's the stigma that they're associated with. Oh, that's a party drug, or I know somebody that took it at the club, and it's totally not the same thing.
Okay, so the stuff that is associated with that, in that negative sense, is that something that is that real ketamine? Because I'm assuming that what you guys work with is real lab created ketamine.
Correct. It's chemically compounded to be ketamine.
Yeah.
I'm not sure what people, what they use, or maybe they just say that it's ketamine and maybe it's MDMA. I'm not sure, but I don't think they're running around with vials like how we administer our ketamine.
Really? Okay. So I think that what I want to try to understand a little bit more is from some of these experiences. Now, have you had people tell you stories after having done this ketamine? Like,
they do. I hear all kind of stories.
Because I'm just kind of curious,
all kind of things.
Because this is all new to me, so I don't know. I don't know anything about it, but I am kind of. It piques my curiosity because I want to know: is it something that is maybe similar to like DMT?
I'm thinking DMT is also a dissociative, so I would say it kind of works on the same thing. It definitely hits the same receptors. Okay.
Interesting, because I know DMT is released in our brain. Like, we all have it, and it's just released when we die. And it's almost like a disconnect of this reality, in a sense. And I've been following that for a while. Now, I haven't tried DMT, but I've always been curious as to the outcome that all these people have with DMT. So this ketamine, if it kind of works in the same way, does it put the person to sleep? Is that what it does?
No, they're conscious, so to speak. They're awake, so they're not passed out. They're not sleeping. Some people do come in and go to sleep.
I see.
But I'd say 95%, and this is new to me as well. I was only familiar with the other psychedelics, with LSD, DMT, psilocybin, stuff like that. Mm-hmm. Because I've been in the medical field, I try to cross over. My background is mainly clinical research, so I'm about science and I'm about facts. Mm-hmm. The job came about, I took it. It was kind of helping me cross over into the psychedelic space, and it just totally wasn't what I expected. I've worked in hospitals. I've dealt with hospice patients. Mm-hmm. The things that people explain to me and the things that I see, I don't know if they see it because they're experiencing their psychedelic trip during this time, but we have to kind of monitor them. So it's when we're monitoring them through the cameras. If their lights are off, the camera view to me is black and white. if the lights are on in the room, then the view to me is in color. And I've seen these orb things, it's just straight. I don't have any, I can't even describe how it looks.
But you've seen stuff then enter into the room. Okay, so I'm going to back up then. So let's say I go in for this ketamine. Can anybody go in for ketamine?
Anybody can go in for ketamine, but there's kind of a requisition for it. Like you have to be cleared by your doctor. If you're seeing any kind of heart doctor, blood pressure is an issue for somebody, they have to be cleared by a cardiologist. Okay. There also has to be like a psychiatric evaluation in the beginning to make sure it's not something that's going to make somebody else cause harm for any kind of condition that they have.
Okay. And essentially, though, once you're cleared and you're able to go in, then
correct.
What you do at your facility then is you monitor them via a video camera, right? How long? Correct. How long is the the trip, or how long is the ketamine?
The sessions are about an hour to an hour and a half. Everybody's time down, I call it, is always different, but it's never less than an hour.
Okay.
Ketamine itself has a life of like 20 to 40 minutes. So some people metabolize it faster than others. It just depends on what their dosage is. So really? We work under an MD that's watching us, and nurse practitioner is there.
Okay.
So we work alongside them to administer shots of ketamine for them.
Okay, this is really fascinating. So now, if I were to go in and have this essentially this procedure done, am I in the room by myself once the injection happens?
You are, but I'm watching you through a camera on my desk, mm-hmm. so I can see if you're disturbed, if you're anxious, if you're having any kind of issues. Like if I like to stay in the room the first 3 minutes. So I'm pretending you're a new patient. I'm just going to give you the whole spiel that we do.
Yeah, please.
So you're going to come in. I always ask them, like, how did you hear about us? Are you coming for mental health? Are you having for chronic pain? That kind of helps me gauge what frame of mind they're coming in. Okay. A person with trauma, person with anxiety is coming in. We just know that we can't just rush in the room. We have to introduce ourselves. We have a lot of people with PTSD, sexual trauma, rape victims, people that have been exposed to murder and stuff like that. Mm-hmm. So we're just very careful with everybody that comes in. I introduce myself. I introduce a doctor that comes in with me. I tell them that their session is going to be an hour and a half, that I can monitor them through the room. I stay with them after I administer the ketamine, or the doctor administers the ketamine. It takes about 3 minutes, 5 minutes maybe at most, for them to start experiencing. And I'm not sure if you've ever taken psilocybin mushrooms or like psychedelic mushrooms.
I have.
It's kind of the same feeling as the visuals start to change, and then you're kind of out of your body.
Okay, so now I'm going to stop you there, because even though I said that I have tried it, the only thing I've tried is microdosing. So I didn't go that far, because it was a opportunity to see the effects of how it would help with anxiety, depression, and things like that. And honestly, my past dealings with any type of psychedelic are very minimal. Although I've only done them out of the curiosity of things. I haven't gone full spectrum in any sense.
Sure.
And it's more of the questioning that I have on our reality, because I hear so much about how these psychedelics actually separate that consciousness, and they help to lift the veil, so to speak, right? That there's this veil on reality, and they lift it. And science itself will just say that they're experiencing a hallucinogenic output of the brain or something to that effect. But
sure,
my experience has always been out of this curiosity to know. And I'm in Colorado, so the ability for me to have that connection is very easy. And when I worked in radio, I met a lot of people in the old days from the dispensaries, So I have a lot of friends in that field. And so when these friends came out and they said, hey, Denver legalized psilocybin, we could do microdosing, then I was like, great, I'll try it. I've never tried it before. The one that I did try, I was still able to drive. I was normal. I was perfectly aware of my surroundings. The visual things that happened to me were more of a, there was nothing that was like a hallucination at all.
Correct. Because the dosages that you're taking were small.
So low.
Currently, people also do that with LSD.
Really?
I went to a conference recently, and they were just saying, like, oh, we microdose LSD. Clinical trials have come out to say that it helps with social anxiety, but more particularly ADHD, which was new to me because I didn't know that. I would have never thought, use it for something like that.
I gotta say, when going through it, there was the stigma of the old days when I grew up in the 90s, the 80s and the 90s. It was, keep kids off drugs kind of a thing. But now it seems like there's some evidence that's showing that some of these drugs in this low dose tend to help with certain things, and they don't cause a disruption in normal activity. Does that make sense? Yeah,
you're completely 1,000% correct. Yeah.
So now with ketamine, is that something that they started working with this process, and then they just started realizing, oh, this is it at a lower dose, or is it the same dose, or how are they dosing it in order to make that work for them?
It's different. There's calculations. They kind of go off body weight.
Okay.
And also we take into consideration if the person has had ketamine in the past, because there's locations that do IV therapy. They do also, they're like these little wafers called troches. And many of these things are used with ketamine assisted therapy. So they follow by talking to a psychologist immediately after.
Okay. Interesting. Okay. Now, so you're going through the process of starting this. So I'm meeting with you for the first time, and I'm sitting down, and then you're going to be with me for about 3 minutes. You're going to make sure that I get the correct dose, and then you're going to leave the room but watch me on a camera. And then I'm going to now, as a person going through ketamine, am I experiencing like a journey, a trip, or how does that?
Kind of both.
Okay.
Fortunately, part of my job, I had never tried ketamine before. I had tried the other psychedelics. So I have that background because sometimes patients ask, is this like LSD? Is this like psilocybin? Mm-hmm. Is this like ayahuasca? And ketamine, although it's closely related to DMT, I'd say the experience, it's still in and of itself totally separate. The best way I can explain it is if you're playing a video game and you have an avatar that's floating above you and you can send it off into space or just a journey in front of you while you're attached, you're definitely consciously separate from your body at this time.
Really?
It's amazing.
So you are out of body in a sense, yeah?
Yes.
Okay.